Welcome to the COVID-19 community conversation with Sacramento County. Feel free to start using the Q&A function to ask your questions. But before we get started with all of that, we're going to be welcomed in by our interpreters who will welcome our community in language on how to access language interpretation. Let's get started with Spanish.
Buenas tardes a todos y bienvenidos a este diálogo comunitario del COVID-19 del Departamento de Salud Pública del Condado de Sacramento. A efecto de proporcionar acceso lingüístico, esta reunión contará con interpretación simultánea al español. Si usted es bilingüe, no tiene que presionar nada, pero si usted no es bilingüe y está en su computadora, en unos segundos verá un icono en forma de globo en la parte inferior de su pantalla. Haga clic en Interpretación de idiomas y después seleccione Español o Spanish. Si está usando su iPad o su teléfono, entonces encuentre el menú de 3 puntos en una de las esquinas de su pantalla. Haga clic en Interpretación de idiomas y después seleccione Español o Spanish, seguido de Aceptar, Finalizar o Done. Y le recordamos que si tiene preguntas, las puede poner en la sección de preguntas y respuestas o Q&A en la parte inferior de su pantalla. Gracias. Thank you.
Thank you. Russian?
Добрый вечер и добро пожаловать на сегодняшнее общественное собрание или разговор с общественностью от имени округа Сакраменто, посвященному пандемии коронавирусной инфекции COVID-19. Сегодняшнее собрание также сопровождается синхронным переводом. Для того, чтобы слушать синхронный перевод, пожалуйста, нажмите на кнопку с изображением глобуса в нижней части вашего компьютера или экрана и выберите соответствующую языковую пару. Помните, к вашим услугам раздел «Вопросы и ответы» Q&A. Пожалуйста, кликните мышкой по этому разделу, заходите и задавайте ваши вопросы, на них будут даны ответы. Большое вам спасибо за внимание. Желаем вам приятного прослушивания.
Thank you. Arabic?
أهلا وسهلا بكم في مؤتمر للكوفيد 19. إحنا موجودين النهاردة علشان نتحدث بخصوص هذا الوباء العالمي وبعض الأشياء من الصحة العالمية وفي حي ساكرامنتو أيضا. إذا تحب أن تسمع هذا المؤتمر باللغة العربية من فضلك اضغط على الكرة الأرضية التي سوف تظهر ثم اختار اللغة العربية، وكمان لو عندك أي أسئلة تضغط على الدردشة اللي مكتوب عليها Q&A علشان تحط أي أسئلة. تقدر تحط الأسئلة باللغة العربي وأيضا تقدر تحطها باللغة الإنجليزية، والأسئلة هتؤخذ بعين الاعتبار واحد تلو الآخر. إذا حابب تسمع اللغة العربية أو تسأل أي سؤال باللغة العربية تقدر ترفع إيدك وكل شيء حيترجم بدقة وتحفظ لي السرية. شكرا.
Thank you. Vietnamese?
Chào mừng quý vị tới diễn đàn Cộng đồng về COVID-19 được tổ chức bởi Cơ quan Y tế Công cộng quận Sacramento. Để sử dụng dịch vụ thông dịch, xin quý vị làm ơn bấm vào biểu tượng quả cầu ở phía dưới màn hình Zoom của quý vị và chọn tiếng Việt, tức là tiếng chữ Vietnamese. Để đặt câu hỏi cho phần hỏi đáp thì xin làm ơn bấm vào biểu tượng Q và A ở phía dưới màn hình Zoom quý vị rồi đặt câu hỏi và có thể sẽ được trả lời. Xin cảm ơn quý vị. Thank you, Liz.
Thank you. Chinese?
你好，欢迎来到今晚 Sacramento 县所举办的 COVID-19 社区论坛。本人在此提供同步中文翻译。假如您需要中文翻译的话，而且您使用的是 iPad 或者是手机，你可以呢右上角有3个点，可以按它出来，然后按中文就可以了。假如是手提电脑或者是线上电脑的话，那您是可以呢在下面有个地球仪，按地球仪出来，按Chinese或中文出来，就可以讲同步中文翻译。假如我们今晚上嘉宾有任何疑问的话呢，你也可以把你的问题呢放在 Q&A 里面，你可以用中文写，然后呢本人把它翻译成英文给我们嘉宾听，他们可以回答您的问题。好，谢谢。
Thank you. Tagalog?
Malugod na pagtanggap sa bawat isa sa inyo. Salamat sa inyong pagdalo dito sa usaping pangmamamayan. Ito po ay pampublikong kalusugan ng lalawigan ng Sacramento. Pagtitipon tungkol po dito sa COVID-19. Kung gusto po ninyo na mapakinggan ng wikang Tagalog, punta lamang po kayo dun sa litrato ng mundo at ito po ay pakidiin lamang. Ano po, doon po sa baba at kung kayo po ay merong mga katanungan, amin po kayong ihiningi na magsumiti po ng inyong mga katanungan. Ano po, dito po sa ibaba at ito po ay sasagutin ng ating mga tagapagsalita na manggagamot. Maraming salamat po.
Thank you. Mom?
nhớ trong trong xét sa tỏ tan ra cho nên chỉ cái tin cha ông ấy sẽ là phụ là còn bé món non từ lúc trong COVID có chưa nhớ trong the Sacramento County Health nó món nó giờ mua cơ bé giờ lo shit thả cho tụi các món nó giờ hai tên này thì saoต้องการmón chả lụt thọ nên cả trò họ gồm như họ cá thọ nên một số trò họ nên nè món trên thế li ở cho nên một trò trong món này thế li nó họ nó giờ tên này món này từ họ mua luôn sản nông là xử lý trả tiền đó nó nên một trò họ kiều này nên sau này cho luôn nhớ trò họ là tàu xí dạ ở trong tàu. Thank you, Liz.
Thank you. All right, so interpreters, if you could go ahead and head into your rooms for language. And once you're in there, you can unmute and begin simultaneous interpretation. Dr. Owen and Dr. Cohen, I invite you on video. And I will go ahead and spotlight you so our community can see our panelists. And then just a reminder, you can go ahead and start to submit your questions via the Q&A function at the bottom of your screen. Our agenda tonight will be a welcome from our panelists and letting us know what's top of mind from them. And then we'll go right into the Q&A from you. All right, let's start with Dr. Owen.
All right, thanks, Liz, and good evening to everyone. So I'm going to start with a general update of our current status in Sacramento County. So we're now up to about 280,000 total cases since the beginning of the pandemic. We've had, unfortunately, about 3,043 deaths here in Sacramento County. Currently, we have 139 hospitalized cases, 21 of which require ICU level care. Both of those numbers are down substantially from their peaks in mid-January. On a positive note, our case rate continues to decline, and it's declined rapidly since our last community conversation. Our current case rate is 5.2 per 100,000 residents, which is down from a peak of about 254 in mid-January. In terms of vaccinations, 65% of our population is fully vaccinated, which is slightly lower than the California average of 70.5. And in addition, there's been about 540,000 booster doses given in Sacramento County. In terms of updates from the state, since our last community conversation, the state released their SMARTER plan. SMARTER stands for shots, so reminding everyone of the importance that vaccines are protecting, especially against hospitalization and serious illnesses, and promoting people to get vaccines when eligible. Mask, to continue to recommend properly worn masks to slow the spread of COVID-19. Awareness, so just continuing to monitor the situation in terms of spread and involving variants. Readiness, so being prepared with the resources and supplies needed to react quickly. Testing, so getting the community testing supplies when and where they need them. So education, focusing on keeping children safely in the classroom. And RX, so expectation that there's going to be evolving and improvement treatments available for COVID-19. That California will attempt to make accessible for everyone. In addition to the SMARTER plan, we've had some significant changes to our state and local guidance regarding schools, preschools, and daycares. So locally, we released our updated school guidance about 2 weeks ago, and we anticipate releasing updated daycare and preschool guidance by early next week. In general, these updates have pulled back on some of the requirements and recommendations that had been in place for in-person instruction previously. So I think the biggest changes are that masks are no longer required, although they are still strongly recommended. And also children and adolescents that have been exposed to COVID-19 but remain asymptomatic may continue to attend school as long as they remain asymptomatic. So these changes seem to be going well so far, and we'll continue to monitor for any changes in in-school transmission. With that, I'll pass it over to Dr. Cohen.
Thank you. I will start out by saying all the things that Dr. Owen has already discussed about the county, we're seeing here at the hospital at UC Davis. So the number of hospitalized patients has gone down quite significantly. I think from probably the last forum a month ago, we probably have about a fifth the number of hospitalized patients. We still have some. The majority of people, though, that are being identified and isolated now are people who are coming in for something else, but because we test everybody coming into the hospital, they test positive. We do have some patients still in the ICU. Those patients are still the unvaccinated population, where we're still seeing some severe illness. We're also seeing much less of our healthcare workers getting infected. We've not really had issues with transmission in the hospital, but we have some transmissions at work when people are eating together. And then most of the transmissions occur outside of the healthcare setting when people are doing the stuff that everyone does in their normal lives. And so we are seeing healthcare workers out. The issue has been that there are not very many out these days. And I think that that's a good thing. We are still masking in all patient care areas. We're not using face shields unless people actually have COVID. There will probably be a change in the UC Davis wide. So we're still following similar policies in non-patient care areas to the campus in Davis. And so the quarter ends tomorrow or Saturday. And so I think we may be changing our masking policies for non-patient care areas where it'll be, again, very similar to what had been mentioned, which is masks will be available and will be recommended, but not required except if you're unvaccinated. And so I think that covers most of the issues that we're seeing here. We still have plenty of meds to treat mild to moderate disease. We haven't been using very many because there haven't been as many high-risk people. So availability of monoclonal antibodies or the oral medications is much better now. Right, it was a squeeze at the beginning. Now it's really not. And the last thing I'll mention is that we are giving the long-acting monoclonal antibody. It's a combination of two drugs, which are tixagevimab and silgabimab. It's known as Evusheld, for immunosuppressed people who wouldn't develop antibody responses to vaccine. And we have been rolling that out as well. So I think from when we started 2 years ago, things have really gotten better. The number of cases are down. The number of severe illnesses are down. The number of deaths are down since we seem to be better at managing patients even with severe illness. And the availability of therapeutics has improved. So while this has been a pretty rough 2 years for everybody, whether you work in healthcare or don't, it's been a rough 2 years, just in different ways for everybody. But we've really made strides forward. It may not always feel like it, but we really have made some major strides forward. And I will stop because I can just keep talking sometimes.
Thanks, Dr. Cohen. And I'm not the best at introductions. Dr. Owen, if you could just let people know what your role is with Sac County Public Health.
Sure. Yeah. So with Sac County Public Health, I'm a consulting pediatrician. So I mostly focus on schools and technical assistance and school reopening, and also daycares and preschools as well.
Thank you. All right, well, let's get to some of these great questions that are coming through. Jeffrey's wondering, how are we getting infected now? First it was lungs, is it now the nose?
So it always is transmitted through the airways, right? Which starts at the nose and ends in the lungs. I think what is being commented on is that the initial variants of the virus had much greater affinity. They attached much better to the lower part of the respiratory tract, so the lungs. And that was particularly true of Delta, which is why the illnesses were more severe. The Omicron, at least the primary Omicron variant, seems to target more upper airways. So it causes the body to develop an immune response, which makes people feel sick. But because it doesn't directly affect the lungs, it doesn't seem to be associated with a severe disease. But because it's in the upper airway, it's also more easily transmitted from person to person. So it's not that we're infected in different ways. It's just that the virus has different targets, and the current Omicron variant, the primary one that we're seeing, targets the upper part of the airway. The earlier versions of the virus targeted the lower parts. So the disease, or preferentially, right, because they both involve both, but it was preferential. And so that's why it was more severe, maybe a little bit less transmissible at the beginning. And now it's much more transmissible, but maybe a little less severe, if that makes sense.
Thanks, Dr. Cohen. So it seems like there are a couple different questions about wanting information about the new variant and Deltacron. So wondering how closely is the county tracking recent developments of the new variant in China, questions about Deltacron. So I'm wondering if we can address some of these different questions around those areas.
So I think the county and the state, I think, continues to monitor the progression and the changes of variants, both locally and globally. And I think that is really part of the smarter plan, which is to say, continue to monitor, constant monitoring of, local community transmission. And if they identify a community where transmission starts to increase significantly, to direct additional resources into that community, additional sequencing, additional testing if needed, and to kind of react in that way. We'll say that globally, there are some places where it looks like the rates have started to increase with the new variant, but here we haven't seen that yet. So our rates have continued to go down, and like I said earlier, the case rate's down to about 5 per 100,000. So there are some places, I think, in the United States. I saw Connecticut today, where they think that the subvariant is starting to make up an increasing proportion of the number of cases, and they anticipate seeing rates to rise. There is some evidence that it's up to like 1.5 times, I think, more infectious. So if it becomes the dominant variant, I think that potentially we could anticipate our cases going up somewhat. But so far, we have not seen that here locally, and the state and locally continue to monitor both changes in transmission and changes in variants.
I might also mention that our colleagues on the Davis campus do some variant analysis of some of the positive tests that we get at the hospital, and then some of the ones that they test screening through Healthy Davis Together and by screening students. And we have seen some, right, the predominance is still the original Omicron, but Omicron 2 or 2A, whatever they're calling it, that variant is showing up. There are some cases. I think the other take-home messages are that the vaccine works as well for prevention of severe disease with the new Omicron variant. So even though it may be more infectious, it may also not cause much more severe disease than what we see. And then the second part, I think something about this Deltacron variant, which initially I thought was supposed to be a hoax, but it turns out that there actually is such a thing. If somebody gets infected with both viruses, the viruses can recombine and come together. It doesn't appear to be a large proportion. And the spike protein seems to be the Omicron spike protein, which means that it's going to act a lot more like Omicron than it is like Delta. And so I think we'll just have to see how either of these affect people. You know, one of the other things I might mention is that because there was so much infection with Omicron throughout the community, I think it does provide maybe a little bit more immunity. I think that places like in China, where they're seeing these big spikes of cases, right, they were locking people down after every single episode. And so they never really got much of their population infected, and their vaccine doesn't seem to work as well. And so I think that accounts for some of the differences. You know, I'm trying to be optimistic about all this. I think we're really, I brought this up at the beginning, I think we're really in good shape. If there does happen to be another wave of cases, and if people are vaccinated, if this is nothing more than a severe cold, I think most people would take that.
Thanks, Dr. Cohen. And there's just two follow-up questions. You got to most of the questions about the variant, but the two follow-up questions are, do we know how many cases, how many BA2 cases are currently identified in Sac County? And as we see information coming out about Deltacron and cases potentially rising in some areas, should we anticipate masking mandates to return?
So in terms of the number of cases, I think it's important to remember that very few of the cases get sequenced. So it's hard to determine like how many cases there currently are. And then additionally, the dashboard for Sac County doesn't give data on the subvariant. So doesn't specifically break out the BA2 variant on our dashboard. So can't provide a clear answer. I would say that it's still Omicron, the variant is still by far the most dominant, but you know, we'll continue to monitor that picture. I forgot the second part of the question. Oh, masking. So, you know, I think it's hard to say with masking. I think, you know, we have to be careful with what predictions that we make. If we see that there is a variant that causes an exponential rise in cases, or a variant that causes increased hospitalizations or increased deaths, then I think certainly it may, and the evidence suggests that masks can slow that, then certainly that would be possible. I think at this time, there isn't evidence that that is occurring or about to occur. So I don't anticipate that a mask mandate would return soon. But, you know, I think everyone's had a difficult time predicting sometimes what's going to come next with this virus. So try not to forecast too far out.
With Pfizer filing for FDA authorization of a fourth dose for seniors, what is the anticipated timeline? And should we expect it to be broadened after for those who are younger?
You know, I guess I'm interested in how the FDA looks at this. You know, most of the data that I have seen have been not yet peer-reviewed studies from Israel, where they gave a fourth dose of vaccine somewhere beyond 4 months after the third dose. And it appeared to provide some benefit, but it really didn't look to be massive, at least in the way I've read the literature. And I think immunity probably does wane over time. I don't think that it's going to be any better at preventing mild disease. It may improve the prevention of severe disease, which is where it will play a role. And it seems to be most important in older folks. But you would think that if immunity does wane over time, that ultimately everybody is going to need a fourth dose of vaccine. And what I'm hoping is that when the FDA and CDC look at this, they actually start designing an actual vaccine schedule in the same way that we have vaccine schedules for most other vaccine preventable diseases. And it makes a little bit more intuitive sense. I think I've said this on this call before. I think a primary course of vaccine for COVID, even in non-immunosuppressed patients, is 3 doses. I just don't think, right? I know that we're still calling it booster number 1, and then it's going to be booster number 2, but really everyone should be getting 3 doses of vaccine, whether they're immunosuppressed or not immunosuppressed. So that to me doesn't make it a booster anymore. And then, right, and then if it's going to be a 4th dose for everybody, then it's a 4-dose vaccine. I think we have to just, and we need a schedule, right? This was sort of selected semi-randomly, right? That 4 months was when they started seeing more cases in Israel. And so they just started rolling out more vaccine. Anyhow, I don't know if that answers anybody's question. I think it's going to end up being everybody. And I think the timing is still to be determined. And my hope is that there's a real clear timeline for vaccinating people who haven't been vaccinated before, and where we manage it like we manage other vaccines. I know there's a goal of trying to find a pan-coronavirus vaccine, meaning no matter what variants show up, the vaccine will be effective. I'm not sure how close people are to figuring that out. And then finally, there's still protein-based vaccines, both now from Novavax and now Sanofi, that look okay too as alternative types of vaccines for people who've been a little bit unhappy with the idea of getting an mRNA vaccine. And I'm not sure what's the holdup at the FDA. I know Novavax filed 2 months ago now, and I haven't heard anything. So I think there will be more options too, and I think there'll be more mix and matching. And the other thing I'll mention also is that the data with J&J for severe disease shows that it's effective too, even though it appeared to be less effective from the beginning. So I think the vaccines are still our best friends.
I think we'll all agree it's good to have friends. So that sounds great. Thanks, Dr. Cohen. So Debbie has a question. If someone has had COVID, are they at a higher risk for getting diabetes? Does it matter which variant they had?
I don't think that they wouldn't be at higher risk of necessarily getting diabetes. I think if someone had diabetes and got COVID, they may have more severe consequences. But I don't think there's any data to suggest that COVID or a particular variant is a causal factor for diabetes.
Yeah, I just don't know the data well enough. I've seen these headlines too, and you know, early in my career, I must say, really early, I worked in a lab where we studied viruses that induce diabetes. And so I think it potentially can happen. I just don't know how solid the data are right now. And I can't speak to it beyond the fact that it's biologically plausible.
Does Sacramento County do wastewater monitoring?
There is some wastewater monitoring that occurs in the county and also the surrounding counties. I think it's in collaboration with other groups and universities, and potentially, I think the CDC may have a program, though I'm not sure. I don't think that we do the monitoring ourselves, but there is some wastewater monitoring that occurs in the county.
How do you determine which cases or how many cases get sequenced?
So the sequencing, I'm not sure exactly what the number is, but there is a specific number that the lab can sequence in a given week. Currently, they're prioritized based on things like hospitalization, or if there's a potential outbreak, or if there's new cases related to travel, is generally how they're determining which ones get pulled out for sequencing.
Will it ever be possible for the COVID-19 vaccine to be paired with the flu shot? In other words, one shot instead of a series of shots?
I mean, we give them concurrently now, so there should be no real reason why they couldn't be pooled together. A lot of it depends on what the vaccine is diluted in and how that's administered and whether it's okay for both. I wouldn't expect this to happen anytime soon. I think, right, I mean, flu vaccine technology is not really modern technology to a large part. And so I think that it may end up happening, but I wouldn't expect that to occur within the next 5 years even.
Please clarify the new CDC guidelines. They seem confusing.
I'm not sure if you can clarify kind of what specific ones they're referring to. I think CDC guidelines can be somewhat different based on what the situation is, whether it's general public or hospital-based or other settings. And sometimes they can be slightly different from California Department of Public Health guidelines as well. So I think it'd be more helpful if there's a specific question people have about CDC recommendations. But otherwise, their guidance can be pretty vast depending on the situation.
Thanks. I sent a quick note. So if you heard that, please go ahead and let us know which CDC guidance you'd like us to provide some clarification to. Will Sacramento County be closing COVID-19 testing sites? If so, which and how many? When there is another surge, will they reopen? I'm happy to take that one, if that works. So Sacramento County managed 13 community testing sites in partnership with community-based organizations. As a result of the increased access to COVID-19 testing through pharmacies and other sources, we had 6 sites exit the program. We still have 7 county partnered CBO testing programs that are through a state grant. And they're available for free in the community. To note, there are a ton of other COVID testing sites as well, and those can all be found on our COVID testing page that I'll put in the chat. To your question of when there is another surge, will they reopen? What we found from a scan of COVID testing sites across the county is that there was just a lot more capacity built throughout the pandemic, and access to testing just increased a lot, whether through your primary care clinic, pharmacy, or other community clinics that popped up even outside of the county's run clinics. And then just to pop onto that question of, is there any chance that there will be more testing sites available in the downtown area to better serve workers and hours before and after work? We've seen a lot of employers that have opened up testing to serve their specific workforce on site at times, and then as well seen kind of the ecosystem of testing expand throughout the pandemic. So we're hoping that means that whoever submitted this question, you're able to find a testing site near you that is more accessible than it used to be. Okay.
And I'll also say that more reliance and continued reliance on at-home testing, and with more at-home tests being accessible from the federal government. And part of, I think, what the state's plan was to understand that there's changes in the situation to get more home testing and more test sites out as needed. So I think there is a lot more reliance, especially in certain settings such as school as daycare, on at-home testing as well.
Thank you. For those of us who received both doses and were boosted in 2021, I know you kind of mentioned this already, Dr. Cohn, but maybe a quick summary from our panelists, if that's helpful. How important is a second booster? My provider does not offer unless immunocompromised. Your thoughts would be helpful. Yeah,
so we're not offering them to non-immunosuppressed people either, but you know, if you just wait another couple weeks at most, the FDA is going to weigh in on what to do. And I suspect, again, for people who are over 65, we'll be lining up for our fourth dose of vaccine as long as our third dose was more than 4 months ago, which for those of us who are older in healthcare, it's long past 4 months at this point. Whether it rolls out for younger people now is open to some discussion. I must say that also that you know, at the beginning there were major constraints because there weren't enough doses of vaccine, and so a lot of the guidelines were a little bit more rigid. Whether things get softened up a little bit because there's more accessible vaccine is also something that we'll wait and see. Again, I think the benefit of a fourth dose over third is it's an incremental improvement. It's not a massive change. By the way, I did put in the chat, there's an MMWR from about a month and a half ago that talked about people who had COVID being diagnosed with diabetes within 30 days after their COVID infection. So if you want to look at that link, you're welcome to. Again, I don't know the data well enough. I don't want to state something inappropriately or incorrectly.
Thanks, Dr. Cohen. So we do have a clarification on the CDC guidance that the community member was interested on clarification on. So please clarify how best to determine personal risk using the recently released CDC guidelines.
I mean, I think determining personal risk, and I'm not sure if that is infection or personal risk of serious illness, hospitalization, or death. But I think a personal risk discussion is probably one that is best had with one's primary care provider, because it relies on a number of kind of factors at the individual level, including vaccination status, previous health status, any kind of other associated medical illnesses, or family history and things like that. So for issues related to personal risk, I would refer them back to their physician to discuss that.
But I also think it's within the context of where you are, right? So So you have your personal factors, and then it's if you're in an area that has higher rates of transmission, that risk goes up for everybody, but particularly for somebody who's more prone to getting severe disease.
Thank you. Cal OSHA is still recommending social distancing. Any idea why? I don't think this matches with what the CDC recommends now. Where does Cal OSHA come up with their guidelines?
I'm not specifically sure where they come up with their guidelines, but I will say that sometimes the changing of guidelines from various organizations can take longer than people like or that people anticipate. And I think there's just many factors that each organization has to weigh in different professional environments. We have heard that we can expect numerous substantial updates to policies across the board over the upcoming weeks. And I think that picture will continue to evolve. And then also, Cal OSHA covers the whole state, and historically transmission rates and hospitalizations and deaths can be very different in different counties. So sometimes there may be counties that are much more impacted by hospitalizations or much more impacted by cases than others. And I think in those situations, Cal OSHA has to make sure to kind of take a look at the purview of everything that's going on across the whole state, where we're more focused on kind of the local regions in a lot of these situations.
There's a philosophical difference between CDC and OSHA as well, which I think sometimes plays out in these things. So Cal OSHA and even federal OSHA, right? The idea is that any transmission is a never event. I think that public health tries to mitigate the risk, but doesn't really look at this as anytime somebody gets infected, this is a failure of policy. And so Cal OSHA ends up being way more rigid in what they do, and they change much more slowly than public health, or in our hospital than our infection control department might change. My understanding is that Cal OSHA is not going to look at their rules until the middle of April, is what I was told. So it's going to stay this way until middle of April unless they change their plans. That is what I have been advised as of last week.
All right, thanks, Dr. Cohen and Dr. Owen. When will a vaccine come out for children under the age of 5?
Oh, that's a really good question. It didn't appear that the vaccine worked quite as well for younger kids. I think that they're still tweaking dosage. So I don't really know what the timeline is. I'm not a pediatrician, so I don't keep it in front and center. But it appears that Pfizer's been a little bit hesitant to move forward with getting it approved for kids under 5.
It's hard to say. As a pediatrician, I think we kind of have to rely on some of the messaging that's coming out directly from Pfizer, which can be problematic, but there seems to be some thought that it could be in the area of June. And there is some preliminary thought that the dose that they had did pretty well with 6 months to 2 years, but not as well for 2 to 5. So deciding what changes need to be made there. So there is some chance that it could be June, but certainly could be later, depending on how the studies continue to evolve.
So we'll take one more question for this part of the forum, because then Dr. Cohen is going to have to exit out. And so want to give you a minute or two to have some final thoughts, Dr. Cohen. So the last question is, should we consider a quarterly meeting in light of the new variant and with still 40% not fully vaccinated? Yes, we'll stop there. Any thoughts on that question?
Well, you guys decide, not me. I'll be here if I'm asked. And so I've said this on all of the forums that I have participated in, and that is that the questions are great. It's fantastic to be able to have this dialogue with the community. I think it's hopefully people have been getting out of it what they want to get when they attend. You know, it could be drinking green beer tonight and you're here. And so I think that is a testament to the fact that we are providing some information that's of use to the general public. I hope as a non-public health person who works in infectious diseases that I provide a slightly different aspect, and if these things continue, I'm happy to participate. If they don't and things keep getting better and better, I thank everybody from the county for inviting me and all the folks for listening to me babble on. Thank you very much.
Thanks, Dr. Cohen. We appreciate your leadership. All right. And if you're still listening, Dr. Cohen, you're getting some shout outs in the chat and the Q&A from community about all the information that you've provided. So really appreciate your participation and all the information that you've been able to share. And don't worry, I brought my green hair for the community tonight. So I appreciate y'all joining us during St. Patrick's Day. So we have another question here. So if my company is requiring employees to return to the office and mask in all common places, are they required to provide masks? If so, is there a minimum type of mask they need to provide?
So I'm not an expert on the Cal OSHA standards, but when I have looked at this question before for their temporary standards, I believe that they are required to provide a mask, and there is some language that it needs to be an approved respirator, such as an N95 mask. So I believe that's the case still, but I would refer back to Cal OSHA to confirm that.
Awesome. If a reaction to the initial vaccination was severe enough that a booster was not recommended, are best practices simply to mask and observe appropriate sanitation protocols? Is that enough to maintain safely? What about those who have no access to healthcare?
I think that's a somewhat difficult question. I think if a reaction was severe enough that a medical provider has recommended against a booster, then again, that's somewhat of a personal decision that an individual has to make based on their risk of infection, based on current case rates, and based on their risk of serious hospitalization or a serious illness or death. So I think there's no universal answer that can kind of talk about what the best practices are in that situation and what's going on in that person's life. I think if an individual is at higher risk or is significantly concerned about infection or serious illness, then they can continue to, exercise the mitigation strategies to the best of their ability at the best capacity. So masking, physical distancing, as much as possible. But that situation would likely be different for each individual.
Thanks, Dr. Owen. When will the vaccine be fully approved for 12 plus?
Not sure what the FDA's timeline for that is. Pfizer has submitted the application, so that all the data for 12 plus has continued to show that the vaccine is safe and performing fairly well. So can't say for sure what their timeline is, but I would expect that it would be fairly soon.
Will there be another update for K-12 schools regarding transportation, athletics, and extracurricular activities?
So locally, we are referring to the state guidance, which has been updated to reflect some athletics and extracurricular activities. At this time, given where things are going, I'm not sure that there will be another update locally about that. Schools have reached out to us and kind of asked about that. And in general, our recommendations are, consider and recommend various mitigation strategies, especially for those who are interested in doing so. And also to emphasize that students that want to implement the mitigation strategies shouldn't feel bullied or pressured, and students that feel more comfortable and don't want to do certain things that they're not required to shouldn't feel bullied or pressured either, and kind of having people make the decisions that are most reasonable for their given circumstance.
Thanks, Dr. Owen. So we finished out all of our questions for tonight, which is great. And some really awesome ones came through talking about everything from vaccines to testing to the variants. And we really appreciate the great insight coming in from community. Dr. Owen, any last comments that you want to provide to folks?
I think just mirroring what Dr. Cohen said, I think we've come a long way in the last 2 years, and we continue to go in a positive direction. But that doesn't necessarily mean that everything is kind of back to normal or over. I am excited about the California Smarter Plan and the idea that, we kind of have to be mindful of the data, mindful of the changes, and keep the community appraised of any changes that occur, and be flexible with what our recommendations are and what we think kind of needs to happen at a local level. So we'll continue to monitor for changes in our case rates, changes in our variants, and kind of adjust as needed, and keep everyone in the loop as to what changes we think may need to occur in the future. But that everything seems to be going in a very positive direction right now.
That's good news. So thanks for sharing, Dr. Owen. So this is our last planned public health COVID-19 community forum. As was the question asked, of course, Sac County Public Health will continue to monitor the needs that come up as it relates to COVID-19 and make adjustments. But for now, this is our last planned COVID forum. So we want to thank you for joining. I know I've seen many names that have come up month after month, and we appreciate you. Big shout out to our American Sign Language interpreters, as well as our language interpreters who have also been with us for many months. So they're a part of the team. And with that, we'll go ahead and close out for tonight.